The TGA has approved the Pfizer vaccine for children aged between 5 and 11. That happened earlier this month. Now the federal government has confirmed the vaccine rollout will begin for those children from January 10. So what are the risks versus rewards here? Joining me live is Associate Professor at the University of Queensland, Dr Paul Griffin, an infectious diseases physician and microbiologist. Thanks for your time. I guess that's a key thing in a lot of parents' minds. How would you sum up the reward, the efficacy and safety of the vaccine versus any risks for this group?
Oh, absolutely. As with all approvals, the TGA didn't make this decision lightly. There was a great clinical trial. Over 1,500 children received that vaccine in that clinical trial, and it proved highly safe and effective in that trial. But we waited till we had some real-world experience. The uptake in the United States was fantastic. They had over 900,000 children vaccinated in the first week alone, and now there's been many million children vaccinated. On careful analysis of the risks and benefits in the clinical trial, and that real-world experience shows that this vaccine provides high levels of protection, above 90%, and is very safe. It's not the same dose we use in adults, it's a third of the dose, and that contributes, I think, partly to that safety profile. And people are probably aware of the very rare event, but the significant event that perhaps does occur in adults in the fight with the Pfizer vaccine, in that myocarditis, and so far we have not seen it in this paediatric group. And many will argue that children get relatively mild disease, and that's true, and obviously something that we're very glad about, but that doesn't mean some children don't get very sick. And it also doesn't mean they don't contribute to the spread of this virus. And as we see the virus enter more and more parts of the country in the coming weeks and months, it's going to be very important to have as many people protected as possible, including children in this age group.
So that risk reward, the number of children ending up in hospital, it does depend on what you're looking at around the world, and I suppose there are different sort of thresholds when they'll get a hospital bed, but it might be something like 1 in 100 or perhaps slightly lower odds of that. So what are the chances from what we know? I think 5 million at least have had the vaccine in the US. How many people on a percentage basis are getting seriously ill? Kids are getting seriously ill from the vaccine. I'm not talking about, a headache or a fever, but how many serious side effects are happening?
In terms of serious side effects, it's actually very rare. So the safety profile in the clinical trials and that real-world experience would suggest that the kids do get those mild, short-lived side effects that we would perhaps expect with any vaccine, sore arm, for example, maybe a fever. But outside of that, the serious adverse events were very rare. And as I say, no myocarditis has been reported in the children receiving this vaccine so far. And in terms of kids being hospitalised, well, as we say, that's a very low number. But there is also an inflammatory syndrome that children can get after they get this virus, similar to long COVID in adults. It can be quite debilitating, and we certainly want to make sure we reduce the number of cases of that we see. And this vaccine will almost certainly help with that to a degree.
And so of the group, either groups, I guess, the test group in Australia, but probably more relevantly, the bigger group in the US, you say no myocarditis, so that's the serious heart inflammation issue. What's the worst that's happening to 5 to 11-year-olds taking this vaccine?
Look, I think it is things like those headaches and lethargy perhaps that we do see, as I say, with any vaccine. And in some children that may be a little bit more significant. But when I say that, it's still a very rare event that children will have anything more than some mild discomfort in their arm or a fever on the day of the vaccine or perhaps a headache. So the proportion of children that get anything more than that is very low. And of course, what I'd encourage people to do, because we know that this is a challenging discussion for parents to have, and we all want to make sure we do the right thing by our children. So I'd certainly encourage people to discuss with their GP or vaccine provider the individual pros and cons to them. But on the whole, as I say, this vaccine has proven very safe in that group, potentially partly due to that dose reduction. But it is also still, despite that, providing very high levels of protection.
Let's turn to Omicron. I know we're sort of inching towards more information about this and perhaps not much of it definitive as yet. But the fact that nobody seems to be saying at the moment, no organised study or so on seems to be saying it's more severe, is that a good sign this far in, particularly given how early on some of the cases now are being reported?
I think the simple fact about Omicron is it's really too early to be certain of very much with this variant. The majority of the reports are suggesting a milder spectrum of illness, which is obviously great, but it does still seem to be quite infectious. And I guess one of the big questions is, will it outcompete Delta in the parts of the world where both are circulating? And really, it's still too early to know. I mean, we have seen it pop up in so many countries now that I think the prospect of containment has well and truly passed. And we really do need to start to get some more information, which will come soon, as to exactly how it compares in terms of that ability to spread and the severity of disease.
And on the vaccine element, I know a lot has been spoken about the spike protons and also the ability for Omicron essentially to get around the neutralisation of antibodies, or to cause the neutralisation. But is the important factor here whether it just prevents serious illness, and is there any sign of a waning of preventing serious illness?
As with everything with Omicron, it's still too early to be sure. We're getting some early reports that from the laboratory-based studies, which are very useful, but tell us only a small proportion of the information we need, that perhaps the protection from 2 doses will be significantly reduced. But then if we have 3 doses, so if people have had a booster, the protection is still going to be reasonable from these early reports with the existing vaccines. I mean, much more work is being done as we speak to really understand the changes, the reduction, if any, in the protection from the existing vaccines. And of course, we're also in the process of making new vaccines should we need them against this variant, as we've done with all the variants in the past, Alpha, Beta particularly, and Delta. But fortunately, with those variants, we didn't actually need to roll out those boosters. If it does come to pass that protection from existing vaccines is not sufficient, then we can roll out an Omicron booster. But it's still too early to know whether that's going to be required.
All right, well, we're getting close to knowing more. The world's sort of on tenterhooks. We'll know more soon enough. Dr. Paul Griffin, thanks for your time today.
Thank you.